Hi everyone, welcome back. In the previous video on ECC, I talked about the definitions and I started with the etiology part. I spoke about the role of microorganisms in diet in ECC. Today I'll be talking about the role of environmental factors. Now what exactly this includes? The environmental factors include oral hygiene maintenance, your genetic factors, salivary flow rate, clearance of food, buffering capacity of saliva, etc. Okay, now this is very clear that to avoid ECC, one should obviously have good oral hygiene maintenance. This can be and this should be rather achieved right from a child's birth. Now how is that done? It's very simple. Cleaning of gum pads, cleaning of the tongue, cleaning of vestibule, all these things have to be started right from the birth. And of course, once the tooth starts erupting, you have to start with toothbrushing. Moving on to genetic factors, obviously they're not much in our control. But then other things such as clearance of foods can be worked upon. Now we all know that solid sticky foods are more retentive and karyogenic than your liquid non-retentive foods. So we need to smartly substitute the karyogenic retentive foods with less karyogenic non-retentive foods. Next is your salivary flow rate. Now first we should understand why is salivary flow rate important. Okay. So low salivary flow rate means more chances of caries. So again, we all know that we cannot always alter the salivary flow rate, but we can definitely alter our feeding practices. By feeding practices, I mean we should avoid high sugar containing foods at night, followed by night brushing. Then there are other environmental factors also, such as low socio-economic status, poor parental education, less awareness, your unhealthy life practices, etc. Okay, so here I've added a schematic presentation of the role of host, microbes and diet in etiology and pathogenesis of ECC. It's basically a shorter version of what we just saw in detail. Now, let's go ahead with the classification of ECC. This was given by Wayne. The clinical features are also different according to the types. So let's have a look at it. So the classification gives us 3 types: type 1, type 2 and type 3. Type 1 is described as mild to moderate form. It involves isolated carious lesions on molars and incisors. This also includes the dull white or brown spot lesions. Mostly the cause is a combination of karyogenic foods and lack of oral hygiene, and this is most commonly seen in the age group of 2 to 5 years. Then is your type 2. Type 2 is described as moderate to severe form. It is seen soon after your teeth eruption. It affects the labiolingual surfaces of your maxillary incisors. Now in this, the mandibular incisors are spared. They are not at all affected. Causes include at-will breastfeeding or your bottle feeding with or without poor oral hygiene. Then is your type 3. Type 3 is known as severe form of ECC. In this, all the teeth, including your mandibular incisors, are affected. This can also be seen in the form of complete crown destruction or in the form of root stumps. Causes are karyogenic food and poor oral hygiene. Now, before we move on to the management part, let us understand one more important terminology, that is rampant caries. Let us see the difference between rampant caries and ECC. So the first difference would be what exactly is rampant caries. Now rampant caries is acute widespread caries which affects the pulp of the teeth at an early stage, and it usually includes the teeth which are immune to decay. So that would include your mandibular incisors. Whereas ECC is just one specific type of rampant caries. There are various types of rampant caries and ECC is just one type of it. Second point of difference would be the age group. Rampant caries is seen in all ages. It also includes at adolescence. So it is not limited to 6 years or 71 months unlike your ECC. And ECC, as we know, is seen in 71 months or younger, or in other words, in infants and toddlers. Then the dentition affected in rampant caries is obviously either primary or permanent, since adolescence has been mentioned. And in ECC, dentition affected is primary. Etiology of rampant caries would be multifactorial. The causes are not limited to oral hygiene maintenance and diet. There are various other causes as well, such as your root recession or weakened enamel, or it can be radiation therapy post your chemotherapy. And etiology of ECC is mostly improper feeding practices and poor oral hygiene maintenance. So that was about ECC and rampant caries. Now let's look at the management part of ECC. So the main focus should be on prevention of ECC. Let us divide prevention at 3 different levels, starting from home care, then professional level, and then the community level. Now, home care is about the strategies or the basic things that one can do at home level. It is as easy as taking care of your diet, avoiding junk food, having a healthy diet, oral hygiene maintenance, which includes your toothbrushing, using fluoridated toothpastes, use of dental floss once the permanent teeth start erupting, and rinsing after every meal. Now, one important point here that should be remembered is we do not advocate use of fluoridated toothpastes below 2 years of age usually. That is because at this age the child has not yet developed the habit of rinsing or spitting out, and we definitely do not want the child to eat the fluoridated toothpaste. So that should be advised only once the child starts developing the ability to rinse or spit. This usually happens at 2.5 to 3 years of age. The second level is professional level, where we come into picture actively. One of the most important points here is counseling or educating the parents on how to take care of the teeth or your dental hygiene. So there is a term called as anticipatory guidance. It simply means educating a pregnant mother about what to expect in a pregnancy, mostly from dental point of view, because we are dentists, we will be talking from dental point of view. So what is to be expected during pregnancy, how and what kind of care does she need to take for herself to maintain a healthy mouth. It also includes educating her about the dental health and expected dental problems of a child and how to prevent those. So this is anticipatory guidance, and this definitely should be given to a pregnant mother. Then other things such as early detection of caries or telling the parents to visit you regularly for preventive checkups is important here. So early caries detection becomes possible and obviously easier to manage ECC at an early level. Diet counseling is one more important part of periodontics, where you substitute the sugars or unhealthy foods into better ones. Then fluoride application, your pit and fissure sealants, all these come under professional level. So these will help in preventing your ECC, if not avoided completely. The last level would be community level. This includes your health education, spreading awareness about prevention, cause of dental caries or your other dental problems, everything. Basically, it is your public health dentistry knowledge. Now that we have covered prevention, let us see what steps we need to take once ECC has taken place. Let us divide into a number of visits: first visit, second visit, a week later, and then subsequent visits. In the first visit, we need to first assess and identify the lesions or the cause of lesions. Also, we need to assess the child's caries risk. So that basically means seeing if the child is falling into a low risk of developing caries or a moderate risk of developing caries or a high risk of developing caries. Next would be starting with smaller treatments like excavation of caries or restoration of caries, that is your simple class 1 GIC fillings, abscess drainage, making radiographs, and planning a proper treatment for the child. Also, one important thing that you should be doing in the first visit is asking the parent to maintain a diet diary for 1 week. So you should instruct the parent to include all his meals right from the first thing that he consumes in the morning after getting up till he goes to bed at night. It should be in detail, as much as detail as possible. In the second visit, you have to evaluate the diet and if necessary make the changes or substitute it with healthier stuff. Then you can also continue with filling other teeth, your class 2 or remaining class 1 filling. Then in the third and subsequent visits, you can proceed with the extensive therapy such as pulp therapy or extractions. Now, pulp therapy should be followed by crowns and extraction should be followed by space maintainers whenever required. Now, once you're done with the treatment, a regular follow-up is done every 3 to 6 months. This depends on the caries risk. So that's it for today. In the next video, we are going to study pulp therapy in primary teeth.